Hello, my name is Maddie Sheely, and I will be presenting on ovarian cancer. What is ovarian cancer? Ovarian cancer is a disease in which malignant or cancerous cells are found in the ovaries. An ovary is one of two small almond-shaped organs located on each side of the uterus that stores eggs or germ cells and produces female hormones estrogen and progesterone. Cancer develops when cells in a part of the body, in which this case ovaries, begin to grow out of control. There are quite a few risk factors. The first one is genetics, BRCA1 and BRCA2, which are breast cancer genes. It is an inherited genetic mutation that is responsible for about 10 to 15% of all ovarian cancers. Women who have had breast cancer has an increased risk of getting ovarian cancer. Second, genetics, Lynch syndrome. It is an inherited syndrome also called hereditary non-polyposis colorectal cancer, also known as HNPCC. If you have this, you have about a 12% lifetime risk of developing ovarian cancer. Third risk factor is family history. Women who have had one first-degree relative with ovarian cancer but no known genetic mutation still has a 5% increased risk of developing ovarian cancer. Some more risk factors include increasing of age. Ovarian cancer rates are highest in women aged 55 to 64 years old. The median age of diagnosis is 63 years of age. Second, reproductive history and infertility. You have an increased risk if menstruation started before 12 years of age, had her first child after 30, experienced menopause after 50, or never taken oral contraceptive. Hormone replacement therapy. It is a combination of estrogen and progestin used to help alleviate menopause symptoms. If used for 5 or more years, it significantly increases the risk of ovarian cancer in women who have not had a hysterectomy yet. Lastly, obesity. It is associated with almost an 80% higher risk of ovarian cancer in women aged 50 to 71 years of age who have not taken hormones after menopause. Next is symptoms. Women are more likely to have symptoms if the disease has spread beyond the ovaries. Symptoms include bloating, pelvic or abdominal pain, trouble eating or feeling full quickly, urinary symptoms such as urgency or frequency, fatigue, upset stomach, back pain, pain during sex, constipation, menstrual changes, and lastly abdominal swelling with weight loss. There are 5 treatments for ovarian cancer. First is surgery. There are 2 parts of surgery: staging, which is how far the cancer has spread. Second, debulking, which is removing as much of the tumor as possible. Second, chemotherapy, which is the use of drugs to treat cancer. It is given in a way that lets them enter the bloodstream to reach the whole body. Third, hormone therapy, which is the use of hormones or hormone-blocking drugs to fight the cancer. Fourth, targeted therapy. It is a newer type of treatment. It is drugs or other substances that identify and attack cancer cells while doing little damage to normal cells. Lastly, radiation therapy, which is the use of high-energy X-rays or particles to kill cancerous cells. Prevention. There is no known way to prevent ovarian cancer. The following things may lower a woman's chance, though: having used birth control pills, having had a tube ligation, also known as tubes tied, both ovaries removed, a hysterectomy, which is the uterus and sometimes cervix removed, having given birth, and lastly, breastfeeding. Lastly, incidence and prevalence among women in the United States. Each year, about 20,000 women in the United States get ovarian cancer. Among women, ovarian cancer is the 8th most common cancer and 5th leading cause of cancer deaths. In 2012, 20,785 women in the United States were diagnosed, and 14,404 women died. As shown in the graph to the right, in 2012, white women had the highest rate of getting ovarian cancer, followed by Hispanic, Black, Asian or Pacific Islanders, and American Indian or Alaska Native women. Thank you for listening about ovarian cancer.